Get started again. We can have our speakers rejoin us. And I can introduce Dr. Cristin Hall. So our next speaker, Dr. Cristin Hall, is an assistant professor in the school psychology program at Penn State. She received her bachelor's in communication sciences and disorders from Penn State in 2000, her master's in clinical psychology from the University of Colorado at Colorado Springs in 2003, and her doctorate from the Penn State School Psychology program in 2011. Dr. Hall has many clinical and school-based experiences with children and adults in a variety of settings, including residential treatment, community mental health, corrections, and private practice. Her work as a research scientist for the Clearinghouse for Military Family Readiness and the Child Study Centers at Penn State has sparked her interest in the dissemination of evidence-based practice using the internet and other technology-assisted platforms. And she recently published a review of technology-assisted parenting interventions that could be of interest as we think about novel forms of intervention with maltreated children and those at risk for maltreatment. So please welcome Dr. Cristin Hall.
Thank you. I'm really happy to be here today and was humbled that Carlo invited me to participate. But then I also noted that he put me at the place on the agenda that's after the afternoon coffee break when everyone is tired and has seen a lot. So I'm hoping you all had sufficient coffee. My experience with child maltreatment and trauma has sort of come from two different perspectives. One was working in an adult community corrections environment with both perpetrators and victims, as well as in the children's mental health environment, both in outpatient and residential treatment settings. And then having transitioned to working at schools, I really started to think very in a much more comprehensive way about ways in which schools could be the hub of service provision for children, but then also recognizing the realities of the very significant challenges that schools have to respond to all of the demands on their time and the demands on their system. But also recognizing that this is where children spend most of their waking hours. So it's also an incredible opportunity if we can really try to come to some way to understand how we can serve children in a more comprehensive way within this environment. I would like to start by acknowledging today that the majority of the content within this talk today is from a forthcoming chapter written by myself, Megan Runyon, who's here, and Dr. Daniel Perkins, who's not with us today. And I just wanted to acknowledge them and thank them because this talk wouldn't be possible without their contributions. As a way of an overview today, I wanted to start with just briefly recapping what you already heard earlier today related to how child maltreatment and other aversive childhood experiences have an impact on cognitive development and academic performance, although those reviews were very comprehensively looked at earlier in this panel, so I won't spend too much time on that. But also talking about what are the current realities of schools in terms of their capacity to implement the ways in which we know that we could help kids in schools related to trauma, and the mounting pressures that schools have to demonstrate hardline academic outcomes for kids. And so trying to understand where schools are coming from in terms of their overall mission. Wanted to talk about also maybe a new way of conceptualizing the perspectives on the role of school personnel and how they might help kids who've experienced aversive childhood experiences and toxic stress. And then I'd like to introduce sort of an overall, more like a public health model using the Institutes of Medicine protractor model to include ways that schools might assist with prevention, treatment, and maintenance related to child maltreatment and other trauma, and then end with some concluding remarks. So the effects of child maltreatment, we've heard a lot about that today, but what we know overall in a nutshell and what we've already heard about is that the majority of the neurological work that happens for children happens before age 2. At age 2, a child's total brain weight is 75% of that of an adult brain. So if we think about what is happening in those first 2 years and how much of that already takes place, and their risk for, and kids at that age and their risk for maltreatment. We need to be thoughtful about that. And the continued, the continued development of both the parietal and the frontal lobes, which occurs primarily from age 7 to 16 years. Although I recently learned that your frontal lobes aren't fully formed until you're 25. So when I think about raising teenagers, that concerns me sometimes. And the reality is that experiences of trauma just wreak havoc on what happens to kids as they're really trying to do the work of learning to learn, learning to manage their emotions and so forth. And essentially that prolonged stress and maltreatment are related to alterations in the very neurobiological processes that are involved in not only the maturation of the brain, but cognitive functioning and emotion regulation. So we've heard a lot also about the fallout of what can happen when kids are exposed to these kinds of chronic and complicated issues. I think the emphasis sometimes is on sort of, is on mental health, clinical outcomes, but I think what might make more sense to think about in the school setting is sort of the issues related to internalizing disorders and externalizing disorders. We have kids that when they have these experiences experience a lot of anxiety. They're depressed, their stomach hurts, they don't want to come to school, they're nervous in school. But they're not very disruptive in the classroom. So they're sort of our quiet ones within the school that I think really are at risk, but maybe aren't caught in schools as having any problems like Carlo had mentioned. Then we have kids who tend to act out rather than act in, who, they can't sit still, they're not paying attention, they're hitting their peers. And these are the kids that usually get called to us, in my work at least, because they really wreak havoc on what happens in the classroom. The concern, though, and the tricky part is that what we're learning is that there are kids who experience pretty significant internalizing symptoms but present as if they are having an externalizing problem. So this is where things get complicated. There are many reasons why kids have issues with, learning to attend, to sit still, to manage how they're acting in the classroom and to engage in learning behavior. But it's not always related to an attention problem per se, and that can get complicated, I think, in our roles in schools, is try to how to understand and unpack and how to intervene. Because I think it would make sense for us to argue that we would probably work with a child with an externalizing issue in a little bit of a different way than a child who really has more of an internalizing concern. More fallout includes what happens to cognitive processes and function and academic performance. The evidence is really clear. There are loss of brain cells, and that's just real. And this relates to how kids are able to process memories, emotion, and so their capacity for learning, storing, and processing information is markedly changed. And what isn't clear is how much kids can actually sort of overcome from that as well, and what is our role within the school environment to acknowledge that and to treat it in a way that makes sense. There are marked deficits on measures of cognitive and academic performance, poor teacher assessments of school performance and adjustment, so teachers are not seeing these kids as managing themselves very well in the school environment, and of course lower grades. And the age-old problems with attention, problem solving, and abstract reasoning, which makes learning difficult. If you can't pay attention to the content, not sure how you're going to learn it, and so that's a continued problem. But now let's talk about the realities of what schools are facing. I think those of you in the room who work in schools in any capacity know that these are real issues and you want to learn about it, and that's probably why you're here. But you also know that there are 800 other things that you're also being asked to do in terms of how you are working with and how you are working with the kids in your charge. The new No Child Left Behind Act has just been authorized, Every Student Succeeds Act, or ESSA. It's the reauthorization of the Elementary and Secondary Education Act and a commitment to equal opportunity for all students, which sounds like a great thing. But I think we all know and love in this room that the No Child Left Behind Act really enacted some top-down standards of performance that really made the work of schools a lot more challenging on a number of levels. How we train teachers, how we evaluate teachers, how we evaluate the effectiveness of what's happening in schools. With the advent of ESSA, there are a couple things that I think have improved since the No Child Left Behind Act days, to include that the standards are not just solely based on one score anymore. We're looking at a multiple measure model, and that it is a more locally state chosen model, which helps to sort of take some of that local control a little bit. That states are charged to develop the standards for the identification and intervention for the bottom 5% of schools. There's also an emphasis on the inclusion of what happens, early in school and at the pre-K level, which is really important. I think that the kindergarten transition issue just continues to be one that we really have a hard time with in sort of this K-12 world, because we have so much already going on. And also changes related to teacher and leader evaluation and support systems that include not only looking at learning, but also looking at how students are working within the environment of schools. So there are some things that have improved, but maybe others that are still continuing to be tough for schools to grapple with in terms of the pressure to perform from an academic perspective. The reality is that I think schools and school personnel are really tired of being told what to do. And I think that that's probably fair. Between what they're told by parents, the school board, policymakers, school psychologists, and others who aren't actually living and working in the everyday in what happens in the classroom on the ground, it becomes very tiresome. So even these well-intended ways that we are trying to help schools to help kids, it ends up becoming just another thing to do and another thing that they have to work through. They have Common Core standards, which is making life really challenging, and there are a lot of concerns around that. There are also challenges related to the administrative changes that happen within schools that ultimately change the focus of what happens at the individual school district level, and often without stakeholder input. New superintendent, new program, right? And with not always a lot of thought or consideration about what that might mean for what happens in the day-to-day in schools. There are issues related to unions. We are trying to make sure that teachers are being treated in a way that they should be treated and that they are fairly paid. But also recognizing that sometimes those are things that also can sometimes get in the way of the way in which we think about the time that, schools are, spending on the various work that they have to do to serve children. And overall, the research is pretty consistent that there is a lack of consistent mentoring, coaching, and ongoing support for teachers. School administrators are asked at this point to enact so much legal stuff, policy stuff, IEP stuff, that it has really gotten in the way of school administrators to be able to serve as sort of core instructional coaches for teachers, mentors for teachers that can help them to work through what they need to work through to work with kids that are having challenges for any reason, to include maltreatment and trauma. So how do we implement programs that work when we know that this is where schools are right now? We look to a field called, we're looking to how we help schools to implement programs that work. And the stages with which we can think about how schools are able to do that is through both the dissemination of the information that schools need to know in terms of what works and what's out there and what are our options. Schools and organizations making the choice to adopt what might work for them and what might help within their context. How they launch the initial sort of workings of these different tools and programs, and then how do you keep it going? How do you sustain these programs over time? Typically in the research world, what sometimes happens, and we don't really mean for it to, but what sometimes happens is we have really great ideas here in the academy, and we create really cool programs that we think are really neat. and we get lots of research money, and we come into the schools and we help you to launch it, and we provide coaching and technical assistance and materials and time and space, and then 4 years later the grant's over, and then we leave because that's what we're supposed to do. But then schools are left to try to figure out, how do we continue these practices without the money and the coaching and the technical support and the assistance? So here's where we find ourselves. Strategies that can promote the effective implementation of strategies that work in school include not only a focus on how to get the information out there that schools need, what does work in this area. So we have to be sort of mindful about making sure that even though we have really neat ideas, how do we get those ideas out there to the people who need them and who might want to utilize them? The next question being, once you know about it, how do you do it? And thinking about what are active approaches that could provide the necessary supports and the organizational and systems conditions for using those new programs and practices. So you know about it, and now how do we do it? What do schools need in order to utilize programs that work? It's clear that teachers need support. They need coaching and they need consultation. We know that one-shot training just doesn't really cut it, because it puts the onus on already stressed and well-intended teachers to take something new and to try to use it on the ground. And when it doesn't work, who's there to help support them with that? And so that's one clear area of need, is that teachers need coaching and consultation. We need leadership support at both the school-wide level and within each of the individual schools, knowing that there is a person there that can help solve the practical problems of space and money and time and logistics, and helping to make that work for teachers and students. But more importantly, I think we need to be thinking about the integration of interventions with other existing school programs. What's already happening in schools, and how can we take what works and fold it over top of what's already occurring? Because then the logistics and the money and the space and all of those things have hopefully already been largely worked out. And then also, why don't we talk to schools and engage them in planning for how to launch these larger efforts and programs? So how can we think about the role of school personnel? I think it would be very easy after everything we heard today to think, well, school-based mental health, trauma-focused therapy in every school. That would be great. I think that would be awesome. Not sure that every school has the capacity to do that. And so there may be some other ways in which we could think about how to make that work. I think overall, probably a logical place to start is for schools to start reframing their thinking about an emphasis on the whole child and adopting more of an overall sort of health model to be able to serve children in school contexts. Children who are exposed to multiple risks, including poverty, the risk of maltreatment, actual maltreatment, multi-generational trauma, all these different things, may not really benefit from the traditional model of service. So 1 hour a week of outpatient or 1 hour a week within the school setting just probably isn't going to cut it for kids who come from these really high-risk kinds of environments. And a whole child emphasis may really help us to improve and to think about the ways in which schools could be more open to collaborating between agencies and to help with a more overarching system of support for kids within their schools, even if they're not the primary entity that's necessarily doing the intervention services per se. How can they situate themselves in order to at least make it easier for those other agencies to do their job as well? Some of this would really require thinking about education not only from an academic outcome perspective, but from the perspective of human rights, social justice. Children are important. We think that they should be well taken care of and so forth. The United Nations Convention on the Rights of the Child And when that came out, there were some really important things that we had to start to consider in my work and relating to not just viewing school psychologists as sort of the sort of, IQ test, role, but thinking about how they can lead school efforts that promote practices that support the overall success of children. How they're feeling, how they're thinking, what's happening at home, making sure that they're eating a more comprehensive model. And looking at the mission of the school, in addition to academic success, which we all agree is critical, relating to serving as the protectors of children in their charge. And that isn't always easy to do, and we'll talk more about ways in which that can be challenging. But overall, I think we can think about the fact that school professionals may serve to identify children at risk or being harmed, which we already are working on in some of the mandated reporting efforts that we have in schools. What are the procedural safeguards in schools that make schools happier, safer, locks on doors, windows, that sort of thing? What are the training needs? And how do we reach out to parents and families as well? So it's one thing to train teachers, but it's another thing to reach out also to parents and help them to learn as well, and to look at who might need some support. Continuing to identify those kids that are in need and to evaluate what those needs might be, that role can certainly continue, but I think also really thinking about the role of the school in terms of serving as advocates for kids in need. So having said all of that, what are some ways in which we could think about how to make that happen? The Institutes of Medicine has come out with a new protractor. I guess it's not super new. I think the last thing I read was it's out in 2007. Schools really require a guiding framework for how to design, adopt, and to administer the services for children who experience adverse childhood experiences, to include child maltreatment. This is one way that we could look at that. The systems-wide change will require the consideration of current needs at sort of the individual level of schools, the capacity of schools, and the training of those who are in positions of carrying out that programming. I mean, the reality is that this isn't what most school teachers are trained to do or to cope with, and that makes perfect sense. That isn't necessarily in their wheelhouse, but it is sort of coming to pass that they will need to be more prepared. Multi-tiered systems of service are already working in schools to a degree, so that first third of what you see up there, so the universal, selective, and the indicated levels are already being used in school. Those of you who have worked in school have seen the big triangle for RTI and for those practices. The good news about the ways in which that's working is there is an existing conceptualization of multi-tiers within the school environment. I think we just need to tweak it a little bit and think about it from a more overarching health perspective. But what helps with the way in which we conceptualize this is it allows schools an element of choice around how they will make this work in their context. What efforts are they able to leverage, and what maybe isn't their role or do they not have the capacity to do, and having some agency in how they do that. The reality is, like I mentioned, that schools may not be in a position to provide trauma-focused care in all cases, and in a comprehensive sort of school-based mental health model. I think we'd all like to see that, but I don't know, especially in this state, how reasonable that is when we have over 500 school districts in Pennsylvania, I think was the last number I heard. So that would be a really daunting task, even here in this area. But at least consider how you might assist with care coordination and providing support to outside service providers, and what is your role in helping to facilitate those efforts. And to include, other models of support like, coaching and consultation with teachers, helping kids to carry through what they're learning, from an outside, agency or whatever within the school environment, and to have that open communication between agencies and schools. So on the prevention side, I apologize that my font got a little bit small, but I wanted to keep the graphic up there for you. We heard a lot this morning about amazing work that is being done around how do